What is varicocele, and why is it a serious men's health problem? Many men hear about varicocele too late. Some live with it for years without realizing it. Varicocele is a condition in which the veins surrounding the testicle become abnormally enlarged. In simple terms, it is a form of varicose veins that affects the male reproductive system. Normally, blood flows out of the testicle smoothly through veins. In varicocele, this blood does not drain properly. Instead, it pools inside the veins, causing them to stretch and enlarge. This process often develops slowly and without pain, which is exactly why varicocele can be dangerous. How common is varicocele? Varicocele is far more common than most men realize. Medical studies show that about 15 to 20% of all men have varicocele. Among men who seek medical help for infertility, more than 40% are found to have this condition. This means varicocele is not only about discomfort or pain, it is directly connected to a man's ability to become a father. How does varicocele develop? The main cause of varicocele is a failure in the venous blood flow system. One of the most important reasons is malfunctioning venous valves. In healthy veins, these valves prevent blood from flowing backward. In varicocele, these valves do not close properly, allowing blood to flow backward and accumulate. Varicocele appears much more often on the left side. In about 80 to 90% of cases, it affects the left testicle. This happens because the anatomy of the left testicular vein is more complex and exposed to higher pressure. Increased abdominal pressure also contributes. Heavy physical labor, prolonged standing, chronic constipation, and activities that raise pressure inside the abdomen can worsen venous dilation. Varicocele often begins during adolescence, especially between the ages of 13 and 18. During this period, the body grows rapidly and the veins may not adapt fast enough. Genetic factors also matter. Men with a family history of varicose veins or cardiovascular issues are at higher risk. Symptoms. Why is varicocele often missed? One of the most dangerous aspects of varicocele is that it often causes no obvious symptoms. However, some men may experience a feeling of heaviness in the testicle, mild discomfort that worsens by the end of the day, pain that increases while standing and improves when lying down, a noticeable difference in testicle size, discomfort after sexual activity. Many men feel nothing at all, while silent damage continues inside the testicle. Why is varicocele dangerous? This is the most important question. Varicocele raises the temperature of the testicle. Under normal conditions, the testicles must remain about 2 to 3 degrees Celsius cooler than body temperature. This lower temperature is essential for sperm production. When blood pools due to varicocele, heat accumulates, oxygen delivery decreases, and toxic metabolic byproducts build up. As a result, several serious problems develop. First, sperm quality declines, sperm count decreases, sperm movement slows, and abnormal sperm shapes increase. Second, testosterone production can drop. Men may notice reduced sexual desire, lower energy levels, fatigue, and reduced physical strength. Third, fertility is affected. Varicocele is one of the most common and treatable causes of male infertility. What happens if varicocele is not treated? This point must be stated clearly. If varicocele is not detected early, not monitored, and not treated, it may lead to progressive deterioration of sperm quality, shrinkage of testicular tissue known as testicular atrophy, chronically low testosterone levels, difficulty conceiving naturally, or complete infertility. In advanced stages, even surgery may not fully restore fertility. Timing is critical. How is varicocele diagnosed? Diagnosis is straightforward but extremely important. It usually includes a physical exam by a urologist, ultrasound with Doppler imaging, semen analysis or spermogram, hormonal blood tests if needed. These tests are painless, safe, and widely available. Treatment options. What actually works? This is where many myths exist. Medications cannot cure varicocele. No pill can shrink enlarged veins permanently. The only effective treatment is surgical intervention. Modern approaches include microsurgical repair, laparoscopic techniques, and other minimally invasive procedures. When performed correctly and at the right time, surgery can improve sperm quality, restore testosterone production, and significantly reduce the risk of infertility. When is surgery necessary? Surgery should not be delayed if sperm quality is declining, the testicle is shrinking, pain or discomfort is persistent, a man is planning to have children. Early intervention offers the best outcomes. Final medical conclusion. Varicocele is not a rare disease. It is not something to be ashamed of, and it is not a condition to ignore. Early diagnosis of varicocele means protecting masculinity, hormonal health, and the ability to become a father. If a man experiences testicular discomfort, abnormal semen analysis, or fertility concerns, seeing a urologist is not weakness, it is responsibility.